Again, my name is Dr. Ramzi Shalby. I'm a child and adolescent psychiatrist. I mainly work in the hospital to see kids whenever they're having a crisis. The aim of this talk is to help you guys understand mental health and what it means, especially in the Middle Eastern and North African community. Focusing on mental health medications and how immigration and then other generations of immigrants immigration impacts our mental health.
Introduce myself one more time. Dr. Ahmad Jabbar, born and raised in New Orleans, lived here my entire life almost, except for a few years where I had to leave for schooling. As mentioned, I am a cardiologist, but I do have a strong interest in mental health because, believe it or not, cardiovascular health or just health in general is really closely tied to your mental health, right? And it has a huge impact. And so in order for us to understand and treat mental health or any sort of disease process, we have to understand what are people witnessing, what are their symptoms, what are they experiencing, and that's why we have things like mental health screenings, right? So screenings are our way of figuring out what is it, what's going on, how are you impacted by some of the diseases. And before we even get into that, let's understand what mental health is. And if anyone has any questions or wants me to clarify anything specifically in Arabic, I'm more than happy to do that. And mental health is just basically a term that defines how you feel, right? How you feel inside, how do you think, how do you act. It talks about, or it helps us understand how you act, right? If you are upset or if you are happy, your emotions, right? What kind of emotions you're experiencing, and how you deal with those emotions and how that impacts your health on a day-to-day basis, right? That's kind of a general definition of what mental health is. And as I mentioned, the purpose of screenings is so that we can really detect what are the signs and symptoms, right, that can lead to mental health disorders. I'll let our psychiatrist kind of tell us a little bit more about the definitions of things like depression and anxiety.
Of course. So what is depression? When we say we're depressed or you have a major depressive disorder, that big word, what do we mean by that? So there's a lot of symptoms of depression, and we have our little book called the DSM that tells us if people have this, they have a high likelihood of having depression. That's feeling hopeless, feeling like life doesn't matter, feeling like you're worrying, you worry a lot, you can't concentrate, you can't focus, low energy, not being able to sleep, and sometimes having suicidal thoughts, having thoughts about wanting to die or wanting to hurt yourself in any way. So they can be very mild or they can be very severe, depending on what's going on in your life.